My name is Jacqueline Wilson, and I will be discussing childhood obesity in Nebraska. Most Nebraska youth are not meeting the daily nutrition, physical activity, or screen time recommendations. Failure to meet these requirements place youth at increased risk for obesity, high blood pressure, type 2 diabetes, chronic diseases, or even other cancers. Nebraska DHHS shares that recommended screen time per day is less than 2 hours. Child obesity has been on the rise for the last 20 years. Only 42% of kids between the ages of 6 and 11 get the recommended 60 minutes of exercise per day. And as those kids get older, the activity level decreases. Nebraska childhood obesity ranks 31st overall. That means that 31.5% of children are considered overweight or obese. I chose this issue because I have 2 young kids myself. Growing up as a kid, technology was different and not something that consumed kids' lives like it does today. In spring 2020, I had the opportunity to help with school screenings. Seeing those results from that school made me wonder what the statistics for childhood obesity would look like in Nebraska. I also know how much time that my kids spend watching TV and playing on electronics. I also know how hard it is as a parent to provide healthy and nutritional options for kids that they'll actually eat. My time spent at Nebraska Methodist College has allowed me to grow as an educated citizen in effective communication, being a change agent, and as a reflective individual. One of the first aspects of being an educated citizen is being an effective communicator. This experience I had while working with a patient who didn't want me in her room, I had to learn how even taking a little bit of time to talk with my patient can truly make a difference. If it wasn't for my instructor taking the time to sit at eye level with that patient and hearing her frustrations, I would not have learned the importance of taking those 5 to 10 minutes to communicate with our patient and how this can change the way they are feeling. This experience allowed for me to use appropriate oral and nonverbal skills. Sometimes patients need someone to listen to them and tell them that they are there for them. Treating patients with holism is sometimes what takes priority in these situations. Nurses need to be able to communicate in multiple ways to both parents and children, making sure to use age-appropriate language to share this information. This could be used by using pictures, written material to support the message, and to improve the understanding of those causes and the solutions with healthier lifestyles. My second experience was during my first week in my world history course. This course was an online class that I quickly found myself struggling like a deer in the headlights when it came to the first week's assignments on a discussion board. I knew I wasn't confident in my writing skills, and I knew that I would struggle with the prompted questions that my instructor had for us when making the argumented post. After a couple of weeks, I was starting to feel a little more confident in my discussion board post. I was not as terrified about what others might post. Instead, I found myself looking to comment on multiple threads in one week with reasons on why I stood behind a certain decision regarding that topic. This experience, I was able to use critical thinking to generate, connect, and organize ideas in my writing. It shows how extremely important communication skills are in life. I was able to communicate and provide a discussion post that was worthy of the assignments being asked of me. Recognizing limitations when communicating with patients is important. When you encounter situations where you feel like your communication isn't getting across to the patients because of possible language barriers or other reasons, seek support from interpreters if it's relevant, or find other forms of communication that work more effectively to support the patient's understanding. The second aspect of being an educated citizen is being a reflective individual. Going into my Nursing 340 course my junior year, I was extremely nervous for what was expected of us. I was nervous for the new task we were going to be learning and how we were going to develop those skills. But by being able to observe my instructors and my fellow nurses administer these IVs, it allowed me to feel a little more confident in the skills I was going to perform. However, I am a hands-on learner, and I learn better from my mistakes firsthand. By utilizing the skills lab to practice the methods of inserting an IV, it allowed me to gain the confidence I needed before I would insert my first IV on a patient. I have learned that I exhibited personal responsibility for myself. It allowed me the most accurate and effective way of learning and practicing IV insertions. By continued practice, it allows for me to perform the task flawlessly as possible rather than fumbling through with my patients. My strengths, though, I believe outweigh my weaknesses. I say this because wanting to have the confidence to perform an IV is both helpful for myself, but it also helps relieve the stress and the anxiety that my patients might be experiencing. As a nurse, I will be able to reflect on the ways of thinking and acting to provide information for my patients who are obese and to help give them a kickstart for options of healthier living. I will also be able to utilize many resources that provide best practice options that are specific for my family needs and to be able to help them meet those specific goals. It was during my senior year that I was faced with an international pandemic, which led to learning online. This presented new challenges for me as I am a hands-on learner and self-teaching is an extreme weakness for me. I had to learn and change the ways that I adapted this far in nursing school and how I studied to learn my new materials. By doing this, it allowed for me to focus on being a reflective individual so that I could focus on what my strengths were and my weaknesses. Moving forward from this experience, I will be able to routinely reflect and engage in habits of inquiring such as logic and critical thinking about the importance of communication and clarifying what is being expected of me. This opportunity allows for me, once finished with nursing school, on ways to help my communication skills. It will allow me to be able to learn new skills on the unit that I am hired. It will also allow for me to have a more open mind on the different possibilities that can arise during difficult situations. When working with children, it is important to keep an open mind and treat them with holism and to provide them support that helps individuals fighting stereotypes that might exist about obesity. As a nurse, I want to make sure that they are receiving the proper information that addresses the obesity problem and help them by stepping outside of their comfort zone of what they have already done or may currently be doing. The final component of a well-rounded educated citizen is being a change agent. During my final semester, I was able to provide care at a skilled facility for many older adults. While answering call-outs for patients, I came across a patient who couldn't wait to tell me her story. When I first walked in, I introduced myself and asked how I could help. She informed me she just needed help to the restroom before her physical therapy. As I was helping her, I had noticed that her pants on the backside were wet, so I grabbed her new clothing and assisted her to the restroom. After sitting down with this patient and hearing her continuously thank me because I was probably super busy and had a million other things to be doing, it made me realize how important assisting patients in a timely manner can help reduce the stress and anxiety they are feeling. It also reduces the risk for injury because of falls or increased infections that could have happened with this patient. My experience at this facility was not what I was hoping for. Hearing patients feel like they are a burden is never a good feeling. I want to continue to be a change agent for the people that I am caring for and educating, so that as a nurse, we are still the most trusted and caring profession which draws us together for a common purpose. While I focus my work on patients with obesity, I will make conscious efforts to provide advice that honors the individual's cultural values, because if this is not taken into consideration, they may not follow through with their actions to live a healthier lifestyle. As a nurse, I need to make sure to adjust my advice to meet those needs for my patients. It wasn't until the later years in my life that I wanted to become a nurse. I enjoy helping people and making a difference in someone's life. My parents have always pushed my siblings and I to give back to others and to help those who are in need. Each Christmas, we adopt families through my mother's employment. This last year, we adopted a family and then heard that in our own hometown that there were close to 20 families who were in need. My dad and I had come up with a plan to ask families in our local church to help donate anything that they could. We had a local grocery store who offered to donate turkeys for these families so that they would have a nice Christmas meal. We had ended up gathering enough donations to give each family a $50 donation along with those turkeys. This was such a heartwarming experience and opened my eyes to see how helping people can change their outlook in life as well. From this experience, I was able to learn to analyze the family's current economics and who are struggling to even have meals on the weekends. I am able to help them by utilizing the resources I know and to provide information that can help them in their needs. Change is more than a Band-Aid. Real change takes intentional efforts. To analyze the situation and to choose appropriate actions, so looking at obesity and advocating for these changes means developing approaches that address the issue. By advocating for systemic change like healthy food choices and more physical activities in schools would have a more long-term impact with the short-term solutions. In conclusion, over my last 4 years in nursing school, I have been able to build my skills as a reflective individual, effective communicator, and a change agent. As I continue to grow into a well-rounded nurse, I hope to continue to expand my skills to make a difference for others' lives. I want to be able to build a relationship in and out of the hospitals. I plan to volunteer in the community and to help lead by example to raise awareness for healthier lifestyles and to provide the resources for those who are in need. Thank you.